This patient education video is one in a series brought to you by the American Academy of Allergy, Asthma, and Immunology, and sponsored through an unrestricted educational grant from UCB Pharma.
Some everyday substances, while harmless for most people, can make other people's skin turn red and itchy. That's because these are potential triggers for allergic skin reactions. Allergic skin reactions develop when you come in contact with allergic substances or allergens to which you are sensitive. Reactions can range from mild itching and redness to a severe rash or hives covering much of the body.
Before allergic skin reactions can be successfully treated, it's important to identify what kind of reaction it is, as well as its trigger. Take a look at what you're doing and what's around you when your skin breaks out. You may need to think back a few hours for foods you've eaten, or think back a few days to substances you've touched that may have caused a reaction.
Some reactions are due to irritants. The difference between an irritant skin reaction and an allergic skin reaction is that the irritant skin reaction doesn't cause the immune system to release the chemicals associated with allergic disease. Irritant reactions occur with first exposure and generally only affect the top layers of skin. The substance is, in itself, irritating and therefore causes a rash. An allergic skin reaction occurs when an allergic person's immune system responds to an allergy trigger by releasing chemicals at the exposure site. A rash appears, affecting all the layers of skin. In this program, we will talk about 3 of the most common skin reactions: dermatitis, hives, and angioedema. The most common forms of dermatitis are contact dermatitis, atopic dermatitis, and seborrheic dermatitis. Contact dermatitis is a reaction that occurs after the skin comes in contact with certain substances. These substances can be irritants such as soap, materials such as wool, or allergens such as poison ivy and some metals. Poison ivy is the most common cause of contact dermatitis. Poison ivy contains an oil called urushiol that causes the reaction. You can even develop a reaction to poison ivy without ever touching the plant, since urushiol oil is very sticky and invisible. It can be spread by touching pets, garden equipment, and sporting equipment that have come into contact with the plant. It is estimated that 85% of the population will develop an allergic skin reaction after being exposed to poison ivy. Poison oak and poison sumac are also part of the poison ivy family and can cause allergic skin reactions. Contact dermatitis can also be triggered by some metals. The most common are nickel and mercury. Nickel can be found in costume jewelry, belt buckles, and wristwatches, as well as zippers, snaps, and hooks on clothing. Mercury can be found in contact lens solutions. People with mercury sensitivity should check the product label before using the solution. Rubber or latex products often cause skin reactions. This is particularly true in the medical field, where workers are exposed to latex gloves and equipment every day. The rubber used in balloons and condoms can also cause skin reactions. There are a variety of cosmetics that cause allergic skin reactions. Examples are hair dyes, nail polish, perfumes, eyeshadow, and lipstick. Finally, there are a few medications that can cause contact skin reactions. Antibiotic creams, penicillin, sulfa-medications, and local anesthetics are all possible causes. As with latex, people who work in the medical field are at greatest risk because their exposure to medications is so high. People who suffer from contact dermatitis can expect to fully heal once contact with a substance causing their reaction is eliminated and proper treatment methods are employed. We'll talk more about treatment methods later on. Atopic dermatitis differs from contact dermatitis in that it is a chronic or long-lasting condition. Treatment will help, but will not cure the rash. Atopic dermatitis, commonly called eczema, is an allergic skin disorder which affects 1 to 3% of all children and about 27% of infants born to mothers who have eczema. Atopic dermatitis tends to run in families that have a history of asthma and hay fever. In infants, atopic dermatitis appears most commonly on the face, behind the ears, and around the mouth. It can affect other areas of the body as well. Like contact dermatitis, atopic dermatitis initially causes the skin to become reddened and very itchy. Small blisters can develop which, when scratched, ooze fluid. As it heals, the skin may become crusty, hardened, and very dry. Parents can take comfort in knowing that most infants will improve by the age of 2 or 3 years. In adults, the rash tends to affect the folds of the elbows, behind the knees, and the face and neck. But again, it can appear virtually anywhere. Although atopic dermatitis is allergy-related, there is no single cause for its symptoms. The symptoms of eczema are just a part of the allergic disease process in some people. However, almost any allergen can cause a person's eczema to flare up. Outdoors, pollen and mold are common allergens. Indoors, dust mites and animal dander can cause reactions. Foods can aggravate atopic dermatitis, especially in children. Specific foods that have been known to cause problems include cow's milk, soy, eggs, fish, wheat, and peanuts. Avoiding or reducing your exposure to the substances to which you're allergic will certainly help some skin reaction symptoms. But further treatment is necessary to minimize your symptoms. Unfortunately, atopic dermatitis is like asthma in that there is no cure. Severe flare-ups tend to disappear as people grow older, but the condition may always be there. The final common form of dermatitis we'll talk about is seborrheic dermatitis, which describes an oily skin condition that has become inflamed. It is not caused by specific allergies, but may occur more commonly in patients with allergies. Common affected areas are the scalp, sides of the nose, eyebrows, eyelids, the skin behind the ears, and the middle of the chest. Less common areas include the navel, skin folds under the arms, breasts, groin, and buttocks. Similar to the other forms of dermatitis, seborrheic dermatitis causes the skin to become reddened and scaly. Mild itching may occur. Seborrheic dermatitis can occur at any age, but is most common in 3 age groups: infancy, where it is called cradle cap, middle age, and old age. While a cause for this condition is not known, it does seem to occur more regularly in people with Parkinson's disease, those recovering from stressful medical conditions, and those with immune system disorders, including allergies. Treatment will help patients with seborrheic dermatitis, but since there's no known cause, prevention of the rash is difficult. All of the forms of dermatitis can be treated, so it's important to see your doctor when you see or feel a rash occur. Early intervention can help keep symptoms to a minimum. Another allergic skin reaction is hives, which are red, very itchy, swollen areas of the skin. They often appear in clusters, covering one specific area of the body. Other times, however, they can cover the entire body. Hives, also known as urticaria, appear very quickly and last from 1 to 2 hours to about 24 hours. They vary in size from about the size of a pencil eraser to as big as a small plate. Clusters may run together to form large areas of hives. Hives are very common. It is estimated that 20% of the population has suffered a bout with hives at least once in their life. Hives can be caused by allergic or non-allergic mechanisms. For people with chronic hives, that is, those with hives on most days for many months, the cause is unknown, but does not appear to be caused by any allergic trigger in the environment. The 2 most common causes of hives are foods and medications. Of the foods that can cause problems, nuts, shellfish, and berries are the most common. Medications that may induce hives are penicillin, sulfa, anticonvulsants, phenobarbital, aspirin, and nonsteroidal anti-inflammatory drugs such as ibuprofen and others. Physical urticaria or hives can develop from sunlight, cold, pressure, or exercise. Solar urticarias are a rare disorder in which hives appear within minutes of being exposed to the sun and last about 1 to 2 hours. Cold-induced hives are more common and occur when the skin is warmed after being exposed to cold conditions. Hives will appear on any exposed area, including the entire body if, for instance, you just got out of a cold lake or pool. Hives can even appear around the mouth and on the lips just from drinking a cold liquid. Dermatographism describes a hive that is induced from firmly stroking or scratching the skin, which may be caused by tight-fitting clothes. Finally, cholinergic urticaria consists of tiny bumps surrounded by a red or white halo. In some sensitive patients, these hives are caused by activities which raise the body temperature, such as exercise, heat, sweating, hot baths and showers, and emotional stress. It has been estimated that 5 to 7% of patients who have hives experience cholinergic urticaria. Finally, there is a group of people who have frequently recurring hives with no apparent cause. This is called chronic idiopathic urticaria. Patients can be otherwise healthy, and the hives will just appear and go away on their own. Like contact dermatitis, if the cause of the hive is a substance you know you're allergic to, then simply eliminating your exposure to that substance should take care of the problem. Other hives may require treatment. Like hives, angioedema is a swelling of the skin's tissue. In fact, any cause of hives can also cause angioedema, and they often appear together. However, the distinction is that hives develop on the skin's surface, whereas angioedema affects the deeper layers of skin. Angioedema generally affects the face around the eyes and lips, as well as the hands, feet, and throat. In addition to the swelling, other symptoms can include redness of the area and itching. If angioedema occurs in the throat, a person can experience difficulty breathing and swallowing. In rare cases, emergency efforts must be taken to open the allergic person's airway. If swelling occurs in the abdomen, pain and cramps can occur. Generally speaking, angioedema, like hives, does not pose a severe threat and will usually improve in a couple of hours and disappear within a couple of days. Be sure to talk to your allergist about any unusual swelling you might have had. Remembering what you ate or what you were doing before the swelling occurred will help the doctor diagnose your condition. Your doctor will rely heavily on your medical history and the appearance and location of your skin condition. For example, if you come into the doctor's office with a rash around your wrist where you normally wear your watch, there's a good chance you're suffering from contact dermatitis and are reacting to the nickel in the watch. Similarly, if you get stung by a bee and later break out in hives, you've probably suffered an allergic reaction to the bee venom. Symptoms of hives and angioedema can disappear after a few hours and may not be apparent by the time you see a doctor. That's why it's important to fully note where you were and what you were doing when the reaction occurred. Blood tests and allergy tests determine if allergic disease exists and point out specific substances that a patient is allergic to. However, there are some substances for which you cannot be tested, such as most medications, and some conditions where the test results won't provide conclusive results, such as chronic hives or seborrheic dermatitis. If you have possible contact dermatitis, but do not know what may be causing it, you could undergo a skin patch test. A patch test involves placing an adhesive strip which contains a small amount of a suspected substance on your skin, usually your back. After 2 or 3 days, the patches are removed, and if you test positive to a particular substance, a small rash will appear. This information will help tell you and the doctor which substances you're allergic to and need to avoid. Once your skin condition has been diagnosed, your doctor can treat your condition and recommend how you can best control your symptoms. If you suffer from allergic contact dermatitis, simply avoiding contact with the substances that are causing your reactions is the best way to avoid symptoms. To treat your rash, your doctor may put you on a short course of oral steroids. These steroids are not the type that you've heard of athletes using. They are a different, safer, and very effective medication. Plus, most patients only require the medication for about 5 to 10 days. An antihistamine might also be prescribed. The same recommendations hold true for those who suffer with hives or angioedema from a known substance or activity. Try to avoid that particular food, drug, or activity, and you should be relatively symptom-free. Since foods may trigger skin reactions, make sure you check the labels on the foods you buy. Small amounts of substances you're allergic to could be hidden in some foods. Also, when going out to dinner, it's a good idea to ask the waitstaff about the preparation methods for certain meals. Many restaurants will offer an alternative to the substance that you must avoid. For atopic and seborrheic dermatitis, topical steroid creams are used to treat the rash. Since these conditions tend to be more chronic, oral steroids are generally avoided, as the rash is likely to return anyway. Antihistamines are used to help control itching, and moisturizers are used to help the dry skin. Again, because these conditions are chronic, infections can develop and delay the healing process. When this occurs, your doctor may prescribe antibiotics for a short period of time. As you can see, allergic skin reactions can cover a wide variety of symptoms and causes. So it's important to talk to your allergist and have your condition properly diagnosed. Be sure to provide as much information as you can and then follow your doctor's advice carefully. With proper treatment, you should be able to resume a normal lifestyle, free from or minimizing the aggravations of allergic skin reactions.
For more information, please call the American Academy of Allergy, Asthma, and Immunology at 1-800-822-2762. Or visit our website at www.aaai.org.